We need to focus on telemedicine and accountable care. Integrated, so people that have dollars at risk are going to be payers or integrated delivery networks. We are an integrated delivery network. Hopkins an integrated delivery network. Other ones like, that are key, critical integrated delivery networks have the ability to bind the payers and the providers together. And what we are seeing, if I were to sketch this out for you folks, I've spent 2.5 years looking at what I'm writing in the next week about the executive summary for our telemedicine business plan. Scott Haas is here, and he's been my partner in crime. And Scott, we've dragged him to the woods, and he's kicked me around a fair amount. We're trying to get this whole process together. But if I were to say, in an accountable care organization, what does telemedicine mean, or e-health? I better choose a less pejorative term. Let's say virtual care. There are 3 different components, in my opinion, and I'll leave it to you folks for the discussion after this. There has to be an acute care component. There will be a command center in most hospitals with an acute care component. This will be looking at things such as EICU, telestroke, teletrauma. When rural hospitals for relationships actually do not have providers, the helicopters can't fly the patient out, there needs to be the ability to actually work with those patients and manage those patients in a remote fashion. We have a resource intensivist. I think we have 140 ICU beds, if I'm not incorrect, in our main facility. We have a resource intensivist that we have a condition A, means the heart stopped. We have a condition C, means it's going to stop. But we now have an RI. And this is an ICU doctor who basically roams the hospital. If anyone gets spooked, from the nurse down to the medical student, they can call the RI. They come to the bedside. They broker the care. The patient is stabilized on the floor. Experts make the decisions. If the patient stays on the floor, the RI rounds on them remotely or rounds on them virtually or face-to-face the next day. So that concept of acute care is critical. It goes far beyond just EICU. The other aspect of that is home care. And home care, we've heard about it, nothing else needs to be said. The only bugaboo to home care is having a rules-based engine that sits in between the wealth of data that comes into the medical devices and the providers. If you hit me with all this data, I am liable and I'm not going to do it. In the realm of e-discovery, just for your information, text messages are discoverable, and drafts of Word documents are also discoverable. So if you pump information into my inbox or my EHR, I am likewise liable, and providers will say no way. There needs to be some intelligent rules-based device that parses the data, and we get what's relevant and who's on call. The middle aspect of true accountable care telemedicine will be a command center-based element of in-hospital protocol-based care. The future of a lot of hospital care will be protocol-based. Whether you like it or not, I'm a provider. I could say this, I'm a sadist and a masochist combined into one. Protocol-based care is important. When patients come to the hospital, protocols drive efficiency in patient care. It drives cost-effective care, and in many cases, high-quality care. It's why EHRs have order sets. It's why we're going to be monitoring quality. So protocol-based care, you'll have a team of people in the hospital watching the protocol through healthcare analytics, through service line analytics, and through payer-based analytics. So these 3 teams providing basic virtual care will be the future of telemedicine, in my opinion, and I think that's an opinion that we're beginning to hold also at UPMC. I'm not saying with arrogance. I've learned this through UPMC. It's a view that we're coming to from a joint fashion here. That if somebody gets sick at home, they go to the acute care side. If they're in the acute care side, they go to the protocol, and from the protocol, they go home. But these 3 components of virtual care will come together. It will be a blend of home monitoring, store and forward, and live, because that's what accountable care has to do. You have to react to situations at home, treat the acute disasters, and broker high-quality, cost-effective care in the hospital. You know, Scott works for the health plan. Our health plan has been very proactive and currently is actually leading our telemedicine charge. I think that says a lot of it. There's been a lot of focus on operationalizing this, but again, I think through true accountable care, you need those 3 components working together. And that's going to be our vision, I think, when all is said and done the next couple months.